your daily dose of health and medical news. I'm Mr. Zaman, and today I'll be talking about the medical code of ethics that have been recently put forward by the apex medical regulator, the National Medical Commission. In the recently released draft NMC RMP Regulations 2022 guidelines, NMC has proposed a code of ethics that has to be adopted by every practitioner of modern medicine that is registered under the NMC Act and are practicing in the country. The National Medical Commission proposes this code of medical ethics, which will serve as the set of commitments of the registered medical practitioner towards patients, society, professional colleagues, and self. NMC Code of Ethics is framed as a self-regulatory set of guidelines reflecting professional as well as social expectations. The ethical principles that underpin this code of ethics include beneficence, empathy, non-maleficence, respect for patient autonomy and confidentiality, integrity, honesty, and justice. Medical practitioners are expected to uphold these principles for their inherent value in medical practice and also to foster trust in patients and maintain the dignity of the medical profession. NMC Code of Ethics is not intended to establish legal or clinical standards in practice, but to provide a set of ethical guidelines according to which the doctor is expected to practice as a medical professional. Ethical guidelines must be differentiated from laws, as ethical standards expected of the medical professional may sometimes exceed legal requirements. The Code of Ethics says that the registered medical practitioner must provide care for the patient with compassion and respect, keeping the best interest of the patient in mind at all times. Should be respectful of the patient's right and opinion, communicate clearly with the patient, and be honest and transparent in all professional interactions. Must protect patient confidentiality and privacy and treat every patient equally without discrimination. Shall ensure one's competency and fitness to practice and keep up to date with advancements in medical practice. They shall consult with other health professionals as and when required for the benefit of the patient. They should function in accordance with the laws of the land. When there is a conflict between ethics and law, the doctor is expected to advocate for changes in the law in the interest of patient care. She shall be responsible to individual and community health needs and advocate for patients and the wider community they serve in matters of health and welfare. Must not refuse to treat a patient in case of medical emergency, nor discriminate between patients based on gender, race, religion, caste, social, economic, or cultural grounds. No patient should be abandoned. Should practice according to his conscience and ethical guidelines, free from external pressures. They should not provide treatments that are not medically indicated and must not participate in any act of torture. They should promote and model the ethical standards of the profession in the workplace, mindful of the moral and professional obligation owed to the patient and society who have reposed trust in the profession. They should not hesitate to report unethical acts, fraud, incompetence, dishonesty, exploitation, or misconduct on part of other healthcare professionals that could result in harm to the patient. They should recognize conflict of interest situations that may arise in practice as they are detrimental to the patient and should avoid or minimize them. In such situations, the patient's interest should take precedent over any other consideration. They should not engage in endorsement or promotion of any drug or medical product for commercial purposes or for personal gains. In sharing findings of research with peers in scientific societies, the practitioner is expected to be neutral and unbiased in the interest of science and patient care. They should protect and minimize risk of patients who participate in medical research, conscious that the dual role as researcher practitioner would require disclosure to the patients and additional regulatory and ethical compliance. They should ensure that professional boundaries of the doctor-patient relationship are respected and not violated. The guidelines include Declaration of Geneva 2017 called the Physician's Pledge, which mentions that as a member of the medical profession, I solemnly pledge to dedicate my life to the service of humanity. The health and well-being of my patient will be my first consideration. I will respect the autonomy and dignity of my patient. I will mention the utmost respect for human life. I will not permit considerations of age, disease, or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I will respect the secrets that are confided in me even after the patient has died. I will practice my profession with conscience and dignity and in accordance with good medical practice. I will foster the honor and noble traditions of the medical profession. I will give to my teachers, colleagues, and students the respect and gratitude that is their due. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.